Good afternoon, everyone. Welcome to another session hosted by Lead Squared. Today's topic of discussion is building growth-ready healthcare systems. I would like to now introduce our esteemed panelists for today's session. First up, we have Mr. Mitesh Dev, Group CEO, Krishna Diagnostics. With over 2 decades across FMCG, pharma, telecom, hospitals, and diagnostics, Mitesh has built a reputation for strategic leadership and operational excellence. At Krishna Diagnostics, one of India's largest PPP-driven diagnostics providers, he's driving affordable, technology-enabled healthcare at scale while steering the organization towards sustainable growth and innovation. Welcome, sir. Next up, we have Ms. Mithali Kalra, founder ICA Health. Mithali's career spans investment banking, consumer tech, and entrepreneurship. She has led 250 crore cost turnaround at Snapdeal, driven US retail expansion at Wahadam Teas, and scaled Swiggy's private brands through a 100 crore cloud kitchen network. Today, as founder of ICA Health, she brings this cross-industry experience to reimagine patient journey with AI-powered platforms. Next up, we have Ms. Kanika Agarwal, founder MindPeers. A serial entrepreneur and angel investor, Kanika has built and scaled ventures across India and Singapore. Driving on lived experience, she's now building MindPeers, an AI agent-powered mental well-being platform that connects and pairs data and therapists. Welcome, everyone. Lastly, I would like to introduce the moderator of today's session, Mr. Sridhar Sampath, Vice President Strategy at Lead Squared. Thank you so much, everyone, for taking out time and joining the session. I would like to also give a shout out to our audience for joining the session. Hopefully, they find the session extremely beneficial. Please feel free to drop in any questions that you have in the question box, and we'll be taking up questions towards the end of the discussion. Over to you, Sridhar.
Cool. Thank you so much, Ashna. And once again, Mitesh, Mithali, Kanika, thank you so much for joining us and agreeing to be a part of the webinar. It's an extremely diverse panel with very, very different viewpoints and business lines run in the past and currently as well. I'd like to take this opportunity actually to get each of you to speak a couple of minutes about your businesses. These are very interesting lines of businesses that we're looking at. So maybe, Mithali, I can start with you. Maybe you can tell us a little bit about ICA Health, and then Kanika, and then Mitesh, quickly about your businesses as well. Just a couple of minutes telling us about what you do.
Right.
Yeah.
Thank you so much for the opportunity. Thanks, Sridhar, and everyone else for inviting me. So essentially at ICA Health, we are looking to offer those who are suffering from gastro or gut conditions, chronic gut conditions, an alternative to conventional medicine, which often has limitations in terms of recovery and relief. So we look at conditions like IBS, IBD, GERD, liver conditions, pancreas, essentially the whole digestive system, where through a combination of diagnostics, nutrition, mental health support, and lifestyle and healthy habits, we are essentially helping people to overcome these conditions.
Got it. Wonderful. I think it's something that's very critical. It's reaching critical proportions today, problems with the digestive
issues, yeah, absolutely.
Yeah. Okay, Kanika, over to you, please. Just a couple of minutes.
Hi, everyone. Yeah, am I audible properly?
Loud and clear.
All right, great. So at MindPeers, we specifically focus on preventive mental well-being. While we do have a panel of about 300 plus psychologists all over India and globally, but very recently, in a year or so, we guys have launched our AI agents, which are accurately detecting early signs of anxiety, ADHD, and burnout, as well as they're giving outcomes in terms of how the physical health is impacting mental health and vice versa. So someone is going through diabetes, and if that impacts your mental health or is leading to, let's say, mood disorders, the agent will be able to personalize that journey for you and also show you the outcome that when you take care of your mind, how did your diabetes get better? So we are going into a very AI agentic sort of an infrastructure. And yeah, that's pretty much what we do.
Awesome. Blending tech and mental health. I mean, that's, if you can pull it off, it's going to be amazing, I think, for the future as well. Mitesh, over to you, Mitesh, a little bit about Krishna. I'm sure most of us know about what you do, but then it would be great to hear about Krishna from you as well. Mitesh, you're on mute in case you're not aware, not able to hear you.
Yeah, hi, Sridhar. Thanks for calling my name up. And am I audible?
Loud and clear, yes.
Great. So first of all, good evening to my co-panelists as well and to all the speakers. My name is Mitesh Dave. I'm Group CEO, Krishna Diagnostics Limited. So, Krishna Diagnostics Limited is Asia's largest integrated diagnostic company, which includes entire radiology and pathology. We work mainly with the public-private partnership, having span over 19 state, pan-India. We got a close to 600 plus doctors in our stride. And we are the only one service provider in diagnostic space, radiology, pathology put together, which is like 24/7. And having operated in the public-private space with the government, working closely with all the 19 states government and union territories, it gives us a leeway to reach out to the tier 3, tier 4 category town for all those needy patients and which really can't afford today's the way diagnostic rates are soaring sky high.
Got
So
it.
our rates are way subsidized to an extent in out of 19 states, we are offering free diagnostic for 15 states. And so it's somewhere it is cash and carry kind of a model.
Okay. Got it. Thank you, Mitesh. That really helps set the context as well for today's discussion, which is all about how the healthcare ecosystem in India can actually get ready for the growth that is anticipated very soon, right? And very interestingly, all three of you sit at areas which are rapidly growing in the coming few years. If you look at the demographics of India as well, as we become a slightly more aging population, as ways of lives and lifestyle changes over the next 2, 3, 4, 5 decades, we are definitely going to see a boom in growth in healthcare services that are going to be required across the ecosystem, right? So one question that I wanted to kick off this conversation with, and maybe Kanika, I'll start with you, is from where you sit, right? You're trying to merge technology and mental health. From where you sit, what do you think is the single biggest barrier that India's healthcare system has to overcome today to get growth ready? Right? Because there is, and I know it's a very clickbaity question. There are probably hundreds of things that need to get sorted. But what do you think, from your point of view, is the largest priority to overcome this?
Yeah, so I think for the barrier part of it, I would say it in two parts. First, the onus is also on the citizens of the country. And that's why, from that perspective, I think healthcare can only become better if we get a preventive mindset. We should not wait for something to happen and then take care of our health. So I think a preventive mindset is very important. And second, from this vertical growing perspective, I would say that for healthcare sector to grow and I would say scale 100x, 200x, it's very important that both at the economy level, when I say economy level, I'm referring to institutions as well as governments. I think we need to start spending more. We need more budget allocations, which should not go underutilized. We need more data contextualization. And I think we need much more research avenues that need to open up in this arena.
Got it. You touched on two favorite pet peeves of mine, which is the low R&D spending in India and the low healthcare spending in India with respect to GDP, but that's for a separate discussion, I think, by itself. Mithali, Mitesh, any views on from your side on what you think is the largest barrier to overcome?
So I think
Well,
from
yeah,
my
I've
sorry,
Sorry.
let's
yeah,
go ahead.
please go
Go
ahead.
ahead, Mithali. Yeah, go ahead, Mithali. Sorry.
No, it's fine.
I called out both of you. My bad. Please go ahead, Mithali.
Right. No, so I think my general observation in this, and because we work in the chronic disease space, and hence views are a little bit leaning towards that. I think one is the physical infrastructure limitation that we are all aware of. You know, in India, we have an acute shortage of the whole doctor-patient ratio, which is, you know, by some accounts, 1:900, 1:1000. That's, we've all been aware of that. But I think more than that, you know, India's disease burden, chronic disease burden, unfortunately, when you look at metabolic conditions like diabetes, hypertension, you know, gastro issues, mental health
That's it.
issues, and so on, will continue to rise unless, you know, we go beyond this very narrow focus towards conventional medicine, which largely revolves around medication, surgery, and those kind of procedures. And if we continue, if doctors only look at a patient, you know, as and essentially, you know, I look at doctors in terms of, you know, I always say that doctors are more like firefighters. They're excellent at saving
Yeah.
your life. But if you go to them with the expectation they're going to build their house, they're going to prevent your house from burning, but they can't build your house. So if we collectively, whether as patients, as consumers, or as healthcare providers, if we continue to look at health with a very narrow lens of medication, surgery, whatever conventional medicine offers, that becomes a really big barrier, and there is no stoppage to the rising burden in that case. So we have to
Mm.
start looking at factors that go beyond, which is essentially your diet, your lifestyle, which are many times the root cause which is causing the problem in the first place. And there, it's very limiting when you look at, for example, conditions like arthritis, where doctors just prescribing medication and completely overlooking all the other contributing factors. That's where we need to widen the lens a little bit.
Got it. Got it. So I think it's also ties in with what Kanika is speaking about in terms of prevention itself. So it's going beyond just the, sorry to use the phrase, Mitesh, but going beyond just diagnosing symptoms and addressing symptoms, but trying to address root causes, which is behind actually causing the disease as well. Got it. Mitesh, over to you.
Yeah, if you'll ask me personally, in India, the multiple areas which are kind of a barrier or hindrance, one first and the foremost is the awareness,
Mm-hmm.
which is about what Kanika mentioned about the preventive care, but I'll take it more a step further as an awareness. Second, if I'll go, is about the penetration, availability of the not just the resources, but availability of the desired resources.
Okay.
Third, if I should go about is something a skilled workforce. Today, we all have witnessed, and there were multiple articles in the news and everywhere. We had the kind of a ventilators and all those stuffs available in the tier 3, tier 4, but there were barely any skilled force to operate that, and because of which multiple casualties happened, and it still lies. Right today, I am operating with the government in the tier 3, tier 4 towns. I know that, guys, putting up the CT machine is, yes, I can buy and I can put it across, but then getting a CT technician or an MRI technician or to do the scans and getting it further reported and all, getting a doctor even to those remotest place is a challenge. AI helps, digitalization helps, but certain areas where the human interventions are required, that's where
Mm-hmm.
it start posing a big problem.
Got
And
it.
lastly, yes, the budgeting around the overall health budget, there are what we are currently spending versus what really is required is there's a huge gap, is a big delta, and which as such posing a big issue onto the tertiary care system. Today in India, we are lack of 24 lakhs beds pan India,
Mm-hmm.
right? And which as such, because of unawareness or all the factors which I mentioned, is putting up the pressure on the tertiary care, which itself is a very low in number. So somewhere these are the four factors that we need to address on a ASAP basis at India level.
Got it. Got it. So I think we've looked at different aspects of what could be barriers. I think they're on both sides of the table. On the government side, in terms of investing and creating resources, on the private sector or the healthcare provider side, in terms of scaling and training and manpower and resources, and on us as individuals as well to focus on our own health and make sure that we are on the preventive side rather than, there was this statement that the CEO of the Hinduja Hospital made sometime back at an event. He said that hospitals are today in the business of disease care and not healthcare. Because by the time a person has actually landed up in the hospital, something has already happened to him. And that shift to prevention is what was being spoken about during that conversation as well. So cool. And I think there's obviously when something has to scale and change, there have to be learnings that happen from adjacent industry segments and adjacencies as well. And I think to some extent, Mitesh, you have been looking at businesses in the IVF, in pharma, in eye care, FMCG as well to some extent. What practices do you see in these extremely consumer-driven organizations, which you can actually adapt to, let's say, the diagnostic space, to make it more relevant and more accessible to people today?
Yeah, so in consumer, if you'll ask me what I have learned or what I have got a experience around, one is like the purely and purely awareness.
Mm-hmm.
Second is availability. And
Mm-hmm.
third is having said that a product, it can be impulse, it cannot be impulse, buying pattern of the consumer and all. And last is the distribution. Distribution is nothing but in healthcare terms, it is penetration.
Mm-hmm.
So more or less factors, if you'll see, are the ones, but the struggle begins or the issues start becoming up, start cropping up is when there has to be a repeatability or managing the patient's life cycle in
Mm-hmm.
healthcare in particular.
Mm-hmm.
So once you are adapted to the one of the consumer product, you may not like to change unless if there is something huge value offering. However, in healthcare today, because of patients' unawareness towards the availability as well as the be it is a doctor or a hospital or the services or the value for money or the experience, that's where the window shopping starts. And once that window shopping starts, will end at a place where it suits your maybe pocket, it may suits your travel, or it may suits your thought process, or the kind of a convenience you are looking for. And it varies from person to person.
Mhm.
So what best we can apply out there from the previous experience into the healthcare is the distribution leading to penetration. Yes, the more you are accessible to the one who is in need of healthcare services. That's where the real services lies.
Got it.
Second is something experience. What you giving out to the patient is
Mhm.
really matters. Patients are coming. We know if somebody is walking into a hospital or a nursing home or on a clinic, is down with something. And
Right.
having said that, if being taken care of well, whether getting cured or no is the secondary, but if being taken care well, somebody has been felt like, yes, it's a value for money, I am being in the safe hand. And that's where your success or the patient's mental satisfaction begins.
Got it, Mitesh. I think your two key points are around accessibility and the experience at the point of service delivery. Both very valid points, I think, and that brings us to something else as well, which is about understanding what the consumer needs itself. Right? You might be available, you might give them a good experience, but if the way you understand your consumers' pain points or the way you look at what is required for the segment is not right, I think that causes different problems. And Mitali, I know you have a point of view on this. Maybe you'd like to chip in on what you think. This industry can learn from how consumers' pain points are looked at.
Right. So, I mean, I just think about, some of my previous experiences be in consumer brands, be it at Swiggy or at Vadam. And I
Mm.
think it's upon us as founders to, observe and, create products, create services which your consumer needs. And it really comes down to how well you observe them, how well you understand. It could come from explicit conversations with the consumer as to, what you're, and some of it you have to gauge and infer, which a consumer may not say directly. Now,
Mhm.
some of these principles we applied even at Swiggy, where we were conceptualizing private brands to basis gaps that we identified. For example, there's a large population of, let's say, Bengali consumers living in Bangalore who crave home cooked, home style Bengali food, right? And that's just a gap that you identify uh,
Right.
and create a product around that. Or at Vadam, for example, when we were working on the green tea products,
Mm.
we would speak with you because America is largely a coffee drinking country.
Mm.
So why would a consumer drink tea? What's her journey? What's her pain point? Why has she switched from coffee to tea? And
Mm.
hence what is her expectation? Because otherwise there's hundreds of brands, and hence what are you
Right.
trying to solve? So I think it's a similar, and again with gut health, this was the reason why we launched it, because many conversations led to this where people said, when you ask them when their journey with their condition started, and most people will attribute it to, oh, I ate something wrong, or I ate something outside, or I don't know when it started. I started developing an intolerance or an allergy towards a certain food item. And then when you probe further, it turns out, oh, I had a really bad, some kind of an emotional setback or a trauma. And then I went to gastro number one, gastro number two, gastro number three, and everybody said, well, can't put a finger on what's going on. But then finally, when I sought therapy or started doing yoga, etc., my gut issues calmed down. So that helps you to connect the dots as to what is missing for this consumer.
Got
Uh,
it.
it's just about a lot of observation and explicit, implicit understanding of the consumer.
Right. And I'm guessing technology, and this is still for you, Mitali, is that with technology now being available so readily, and I think healthcare outside of consumer healthcare is another segment that really has a lot of patient data within it, right? A lot of actual personal slash private data that you would call is actually available. Do you see technology playing a role in quickly understanding and trying to form parallels to these alternative approaches to health as well?
Yeah, so I think in terms of the tools that we are looking to build or in the process of building, where we see technology is largely around enhancing the service that a service provider, a human healthcare provider would be offering, which is
Mhm.
prone to errors like inaccuracy, or just misdiagnosing something, or missing out a critical piece of information. Because if you look at any, be it a doctor, be it a nutritionist, he or she will have certain limitation of bandwidth, time,
Right.
What are they thinking at that point, their own fatigue, and so many factors that come in when they are probing or investigating a patient.
Right.
And to some extent, technology is protected from those
Right.
things, right? So you
Yeah.
can really go deep and dig in terms of trying to get to the bottom of, and but then obviously there's a human element which is absolutely necessary
Of
in
course.
terms of
Yes. Yes.
coaching and so
That is
on.
undoubted. Yeah.
But I think for us, even in terms of what we are building, it's more around driving accurate diagnosis, because if you've got the correct diagnosis, it's half the battle won already.
Right.
So yeah.
Cool, thank you. And that segues nicely into what I wanted to check with you, Kanika, is about the staff burnout, right? She mentioned about fatigue, and when you're looking at patients day in and day out, it's not easy. It's not an easy business to be in. You're looking at some extremely hard to see, people out there. So how do you think leadership within the healthcare ecosystem can take care of the mental well-being and psychological sturdiness, for lack of a better word, right, of the healthcare staff itself? That is point number one, of course. And then how do you extend that to the corporate world? Because while healthcare staff has its own stress, I can vouch for the fact that I had much darker hair and much better hair about 5 years ago, right? So how do you get this into the ecosystem?
Yeah, I think it's a very tough one because,
Mhm.
and I would want to be a devil's advocate probably in answering this because uh, before I myself went through mental health issues, I as a leader really lacked empathy. And only when I got onto the other side after my first startup and then now this one, I started understanding the importance of how just taking care of your overall health
Mhm.
translates into very simple things like productivity,
Mhm.
irrespective of whichever industry you are in. But the problem today that we face is that, and also because we work with organizations, like our prime business is to work with corporates and insurers and all of that. And what we're seeing is it's very hard to convince leaders
Mhm.
that taking care of your staff's health or taking care of your organization's health can actually translate into much more better work environment, productivity. You can save a lot of money and all of those things. So I think that's the first point. So, and which basically means that even before a sophisticated technology tool or solution kicks in, it's important that something like this is ingrained in the culture. And how do
Mhm.
you do that? Like, and I think I personally believe in very simple initiatives. For example, like, and we have seen this, happening and giving outcomes. Now, let's say 2 hours in a week where a leader makes it, let's say, a reflective hour, where the leader says that, look, you know what, I'm going to be vulnerable to my team members. I'm going to share that what are the challenges I went through, whether personally or like in my professional life. Now, that instant vulnerability is going to create an atmosphere of psychological safety where the
Mhm.
employees would feel that, if my leader can be open about it, it means that I can also be open about it, right?
Mhm.
So I think very small initiatives, but I do believe that it has to start from leadership, where
Mhm.
vulnerability, where psychological safety, the ability to just express yourself. And then, of course, very small initiatives here and there, which again get ingrained in your culture. For example, are you giving burnout leaves or not? Are you being conscious about the number of hours per healthcare staff, or even in the corporate world, an employee is working? What kind of flexibilities are you giving? So I think
Mhm.
that's I would say that's something which is the foundational level of this pyramid. And then after that, uh, I'm again just citing examples from what we see and what we try to implement. We of course try to give something which is a combination of human and
Mhm.
technology tools. So let's say implementing AI tools which are probably personalized for the person in a way that they talk to them, they understand them. I think I'll give a small example to make more sense out of it. So now in
Sure.
Mind Peers, the agents that we have this one AI agent, which is all about coping mechanisms. And the
Mhm.
reason for that is that we have a shortage of mental health professionals, not just in India, but globally, which means that Let's say I came out of a meeting, I'm feeling very overwhelmed. I was not able to speak up in the meeting, and I just need some instant help so that I can get through the day, in my workplace. So now what that AI agent does is that it asks the person that, hey, how did the meeting go? And the thing is that the agent is integrated either in Teams or Slack or whatever communication tool the workplace uses. And let's say the person says, hey, could you have gone better? So it'll just ask a few, questions here and there. It's going to contextualize according to the personality of the person, and if they have been seeking help from mind peers, therapists, and all of that. And then this agent is instantly going to give them resource, right? So
Got
that's
it.
what we call instant coping mechanism. And then last part would be deploying them confidentially, right? Like leaders not saying that, hey, I would want to know what each and every employee is going through. All of these things have to happen in a lot of confidentiality. So I think generally in healthcare, confidentiality plays a huge role. So I think
Yeah,
these
I
are a
think
couple
that's
of things that I would want to mention.
yeah, that's, I think, basic hygiene, right?
Yeah.
From a healthcare practitioner, that's something that you obviously anticipate. So, Mitesh, coming back to you, I think I have a two-part question for you. One is from what Mitali and Kanika have spoken about. Obviously, as the head of your organization, I'm sure there is a lot that you have to manage for your teams, right? And as on the one side, there are aggressive growth targets, etc., to be met, and you still have to take care of, in general, your employee well-being. And while you're doing that, I also wanted to ask you about it's a unique operational model, I think, right? The public-private partnership that you have with the government today in spreading the diagnostic facilities across the board. Where do you see such partnerships or such scaling typically having breakdowns? So I think there are two aspects to it. There's people and there's infrastructure and processes, right? Maybe if you can give me your thoughts on both, it would be interesting. It would be an interesting point of view.
Yeah. So, first point where the aggressive growth targets,
Mhm.
and secondly, where in the PPP partnership where the things are going down or waking up.
Where they can
So
break.
so taking the things one by one. So yes, aggressive growth targets is something I'll not deny to it,
Mhm.
but it certainly in the kind of industry which I am currently into, it gives me a leeway where it's not about generating the demand. All the aggression goes with most of the companies, or I said almost all the companies, is about generating the demand. While
Mhm.
with us, it's about catering the demand
Understood.
because we are catering directly with the government. So we are there into all the government hospitals, PHCs, CHCs, be at district level or sub-district level, across at taluka level and PHC primary healthcare center, even at an remotest part of the country, right? So if you'll see in any of the government dispensary or hospital or nursing home anywhere, demand is already there. There you will see lots and lots of patients are there. The
Mhm.
challenge for me, the targets for us is to cater them,
Mhm.
right? So if in a morning OPD, I have, let's say, close to 800 plus people who are lining up or queuing up for the blood test or the CT or the MRI, X-ray, USG, whatever. Now, managing those queues, managing those patients, their timings, building up, bringing up the reports well in time so that they can go back to the doctor, get themselves checked, and further giving out the desired medicines or the cure for them. So here, for me, whilst catering the demand is where onto the aggression level, but it's about putting up the right system and process in place,
Mhm.
wherein manning number of patients per person, as in the one who is inside our center or the lab or whatever. So man is to the patient, human versus the patient ratio, how much is really required. Since we are 24/7, so it calls for 3 shifts, backup to each person, and then making it available. Backup to not just the person, but backup to the machines also. So
Mhm.
that's where it really helps me to figure out or to maintain keeping a stress, because today a stress level, if in a center or a lab, if I have to ask you, is why delivering the right report in the right time is what,
Mhm.
be it is my technician or the doctors, is really struggles with. But giving them out the backup options, giving them out the right manning, and giving them out the right kind of a machinery or the equipments is really sorts out their life very well.
Got it.
Coming
Yeah,
on to the
it's like
second
with the
part.
industry, right? You can't afford to make a mistake of giving report A to person B. That just cannot happen.
Absolutely, absolutely. It's purely a process-driven stuff, right?
Mm-hmm.
And it should be seamlessly integrated with the patient, where they're able to get the right report at the right time.
Got it. Got it. Understood. So I think there's obviously a large amount of scale that you're handling over there, and to some extent, I think, like you said, demand is not a problem for you. It is about catering to the demand that is already present. In terms of on your side, Kanika and Mitali, I know both of you are fairly young organizations and starting up and setting forth on this journey, but from a design perspective, org design perspective, or process design perspective, what would you do to make sure that you're able to cater to sudden shifts in demand? Like, for example, they could, God forbid, but let's say there's another pandemic, right? Like, you could see certain demand fluctuate really rapidly. God forbid, there's some other event which causes some fluctuation in demand. How would you look at designing organizations and processes to actually to meet that demand and sort of ride that wave? Maybe Kanika, I start with you and go to Mitali.
Yeah, sure. I might come across as a lover of AI here, but
Mm-hmm.
honestly, I'm just talking about things that we're practicing internally. So I'll give you an example. Now, we all know that mental health professionals way low, and today, I mean, just in India we have about 180 plus, and we also have to ensure that the quality is there, and every week we sort of need to get 20 more on board, because
Mm-hmm.
the demand for mental health has just been on a rise. So now what
Right.
we've done is to make the process, let's say, more automated, and the
Mhm.
entire, like the word they used was design process. What we've done here is we are actually building a lot of our own AI agents, even for internal, usage. So now a
Got it.
small example, hiring of a good quality psychologist usually on our end takes about 4 rounds. Okay,
Mhm.
their degrees, their certifications, because it's such a subjective healthcare area. We
It
also
is.
need to make them go through mock interviews that, okay, what would you do in a situation like this and XYZ. Now, what we've ended up doing is we've made a hiring AI agent on our end itself. So out of the
Okay.
4 rounds, all the first 3 rounds have been automated. So, and how did we do that? We basically took the data from our last 4 years, and that we merged the success rate, we merged what worked, what did not work, and all of that. So a lot of contextualization. And then we fine-tuned our existing LLM that we use. And now we have this hiring AI agent, which is readily available and doing 2 people's job, right? And
Mhm.
that's how we are scaling. We're able to take that to the next level. So I think my precise answer to this is that adoption of technology and the understanding of how we can go away from our legacy IT systems, because that's I also saw it in the poll, and that's a very important one, that how do you learn to contextualize your data even internally and then make
Right.
things out of it to make your internal processes faster. I think that's one bit that I would want to share.
Got it. Because I don't think legacy systems are really going anywhere. What needs to be done better is we need to figure out ways to work with them seamlessly. Uh, yeah,
Yeah, yeah,
data and
integrating them,
yeah,
exactly,
yeah,
integrating them and making sense out of them and then nuancing them and all of those things.
yeah, yeah. Mitali.
Right. No, I think to some extent I echo, what Kanika is saying. Like we've had this challenge where it's not just, I mean, demand is one, but even on the service side, when we're delivering to our patients, let's say uh, two nutritionists or two care providers or coaches suddenly quit, and you don't have a, even if you were to hire a person soon enough as a replacement, you will not get a person who is well educated or well trained in gut health, for example, because you'll get a
Right.
generic nutritionist. And to train them will take, previously when we first started, it used to take us anywhere between 3 to 6 months to get a person up to speed to handle the most complex of cases. Now
Right.
today we've built out processes where the onboarding, training, etc. can happen much faster, and the person is good to go to handle complex cases within a few weeks of onboarding. And so there again, SOPs, tech, those things help. And if there's a sudden rise in demand, you can always get more resources ready, up and running much faster.
Got it. So I think process design becomes very important and critical for actually scaling businesses. But on the flip side of that is also about trust, right, Midali? So for example, while Kanika spoke about a lot of use of technology and automation, which is bound to happen given the advancements in in the last few months, right? How do you still keep the customer's trust And what is it that organizations have to watch out for so that they don't go overboard on automation, that they start losing trust, because then you lose business, right? And we spoke at the start itself that in healthcare, sort of privacy and trust are very, very core essentials. So I know you have a point of view on that and would love to hear that.
Right, right. No, 200%. And I think because our business is largely around coaching, and
Right.
we've had instances where, we've had to transfer a patient, to another care provider midway through their program, for example, and they're not happy about it because they get
Mhm.
so deeply attached to the coach who they have been confiding, who's been tracking their symptoms and daily progress, and like a cheerleader and so on. And to that extent, we've noticed vastly different response coming from the patient when there's a bot asking them a question like, "Hey, what did you have for lunch today?" Versus,
Mhm.
a ABC, a Priyanka, or a Sakshi, or a specific person is talking to them. There's just a dramatically different engagement level. People
Okay.
don't necessarily beyond a point, they'll answer a few questions, but beyond a point, I think we've all kind of learned to observe that this is, like, we can easily spot a chat GPT answer versus a real human answer, which will have
Right.
typos and mistakes and vernacular and so on, and those many things, right? And so to that extent, I think for us, we do believe that the human element plays a huge role when it comes to coaching and patient engagement. And technology, like I said, I mean, I at least see it to where we are, we see it driving more accuracy rather than driving engagement for us, for our patients.
Okay. Okay. Got
Sridhar,
it.
sorry, but can
Yeah.
I just add on one very quick
Sure,
thing?
sure. Yeah,
I
yeah.
think trust in healthcare is also about outcomes.
Mm-hmm.
While of course the process is important and there are different verticals, but I what we've seen from our experience is that when you're able to show outcome, the trust is
Yeah.
built. Right?
Yeah.
In physical healthcare, it's a bit easier, but for us, where it's very subjective, working towards showing that hey, is the person really improving or not? Is the
Mm-hmm.
person showing signs of progress or not? I think a
Mm-hmm.
lot of trust is built from there as well. And that's where I think, again, the combination of humans, like professionals, and technology
Right.
coming together to show the person like the outcomes of having of outcomes of taking care of themselves. I think that adds a lot of value.
Yeah, no, 100%. I think that goes without saying that, if a person doesn't start seeing the needle move on their parameters, on their symptoms fairly quickly into any sort of a program or a coaching program, the trust starts to drop and the engagement starts to drop almost, very quickly. And then it's very hard to win that back.
Right.
So yeah, that kind of goes without saying that they have to start seeing results. People are impatient for that, and you have
Yeah, very, surprisingly, a very similar point was echoed by somebody from Dr. Batra Homeopathic Clinic as well, because it is again one of the alternative styles of medicine and treatment. And there again, they, need to have 7 to 8 to 9 months of engagement with the patient, because actually before the customer actually starts seeing outcomes, right, so to speak. So that's another challenge that they're trying to overcome. And I thought that was a very interesting problem statement that they had as well. Got it. So what's interesting is, again, when you're talking about providing all of this, right? You have to build trust, you have to stay close to the patient, you have to keep them engaged, and all of this as the market is scaling, as the ecosystem is scaling. Obviously, there are multiple partnerships that come into play, right? At some point, obviously, an organization can't do it all by themselves. Now, whether it is your vendor ecosystem of partners or actual delivery partners or whatever it may be, you would have a partner ecosystem that is sort of helping you grow over here, right? And Mitesh, maybe I can start with you to understand, especially in diagnostics. I know it's a very, there's real estate, there is technology, there is actual hardware, there is people, there are multiple things that go into making of that business, right? How do you see partnerships helping the ecosystem in India grow and helping sort of ride this growth wave as well? And what
Yeah.
is a good partnership and what is a bad partnership, right? I don't know if that actually exists, but I would just love to hear your view on that.
No, so while any day it's always good to have somebody who shares your vision. If not vision, maybe is ready to align with your vision, maybe doing for them for their businesses. So partnership helps always, number one. And
Mhm.
yes, in healthcare, because healthcare itself, the today's healthcare definition versus the way it was going back 10 years below, it is completely different.
Mhm.
previously thought down the line a decade before or a little more than that, it's all about the just a doctor, right? Healthcare, that is doctor. Today, it has gone to a level where doctor is the one core entity, certainly, who's going to get you cure or help you out to come out of the state which you are currently into, which is not really conducive. But apart from that, there are many, many factors in terms of healthcare. So it's right begins at the from the time of reception. So when I call of a reception, that means as an entire ambience of an hospital, nursing home, whatever. So which goes out with the partner who is into the vendor who is building up such kind of an infrastructure and all, which gives out a soothing feeling.
Got it.
Goes further with the wherein the kind of a technology in terms of registration to the time of you are coming out of the hospital as a medical record department at the end. It should be seamlessly integrated that yes, on a click, because 65% of the people are tech savvy today in India. Everybody carries their smartphones and they want to go ahead with the same. Going with that, people also want to have an kind of an convenience wherein on a click or on a phone call, they should able to get the kind of a services whatever they are looking for. So yes, partnership is very important to an extent. Let's say today, if I am onto the digital platform, and I got into the electronic media, I run out the ad or a runner on any of the news channel, and I am having now 10,000 call landing up to me. Me personally into the healthcare, attending those 10,000 calls is challenging because I'm nowhere into the call center business. Then I have to partner it out with the call center guy.
Right.
There would be the inquiries, right? Yeah, of course, maintaining the confidentiality of the patient, their records, their histories, what kind of a things around. So that is a more of a process of the operation stuff. But yes, I have now partnered with the call center who is taking care of all my leads and the inquiries, getting it converted, bringing it down to me. Right. So yes, and whenever it goes bad, again with the call center examples, we although haven't gone to many of the blood collection centers or the companies, but still we are getting messages in our mobiles, asking out for their services to be taken up. So
Got it.
leakage of the data, right? Sharing out, sharing out the confidential information of the patient. Today, while was in IVF, right? A patient who has got beta HCG negative, that means her pregnancy test has come negative. All of a sudden, then 10 of the messages gets into her inbox from the various infertility centers or the doctors seeking out that we got to understand that you are looking it around and it didn't go well. Why don't you come and have a discussion with us? Now, that's something where the leakage happens, and patients' database confidentiality is of utmost priority. So
Right.
those are kind of a bad partnership, which really hurts out.
Got it. Got it. Thanks. And so I think that brings me towards sort of trying to wrap this up with some sort of a AI overview, because that's currently what is really running. And Kanika, I think you guys are doing some wonderful work around that space as well, is to understand what lessons are there from sort of building with AI, right? Now, Mitali, you would have something maybe on a different part that you would be using AI with, like you mentioned, within training or within education or knowledge sharing. And Kanika, you're using AI for a completely different purpose, and Mitesh might be using it for a completely different purpose. But how do we look at responsible and ethical usage of tech and AI in general across the healthcare space? Mitesh has already given a wonderful example of how it is not technically, not ethically the right way to use it. Would love to hear from you guys as well. Any of you can go first.
Natalia, you can go first.
Right. I mean, I think for us, the use case is still fairly limited. We've
Okay.
just started dabbling in it a little bit, and some of our coaches have started using it for the kind of guidance or responses that they're giving to the client, especially somewhere where they need additional technical information or knowledge, or somewhere where they're not able to logically explain a point to the client, and they feel that
Got it.
a well drafted response will help. But I think it just comes down to guardrails that as founder, as business leaders, you need to put in place and continuously remind your team, because they may not be so mindful whether they're uploading somebody's colonoscopy report into an AI tool and saying, hey, what do you think? How do we make sense of this? Now you have to repeatedly. I mean, this again, this brings me back to my early years in financial services, where we were continuously getting trained on ethics and usage of technology and so on.
Yeah.
And you have to continuously remind people that these are the do's, don'ts. This is a gray area. If there is a doubt, ask your leader, ask someone whether this is kosher or not. So I think one is that you explicitly state those guardrails, that please don't upload patient data into some kind of a tool which doesn't have guardrails, and then keep repeating that message
Got it.
again and again, right? So.
Yeah,
Kanika?
I think just two bits to add to that. First, I'm going to just talk again from what we have learned while implementing our AI agents. It's very important that we start to update our privacy policies. It's a very underrated thing. But as a healthcare company, it's very important to put it out there to let your customer know that if you're sharing this XYZ data with us, what are we going to do about it? How is it going to be used? And what is going to come out of it, right? So if you're giving me this data today, what am I going to do with it, and how can it benefit you? So I think that responsibility towards end users, towards end customers, and that being seen in your privacy policies, in the access controls and all of that, very important. Second, we learned it the hard way in the sense that when our own corporates all over the world started questioning us that, hey, what kind of compliances do you have in place? That's when that there are now a lot of AI governance frameworks that have come into picture. And there are actually proper audits that are being done in terms of how you're going about your AI governance. So I think just the second thing I would want to say is that just like how you have HIPAA compliances, you have GDPR, ISO 27001, now there are these AI governance protocols as well. In fact, there is a newly launched ISO protocol that is just for healthcare companies who are coming up with AI stuff. So I think being very on top of that helps, not just because externally it adds to credibility, but internally also it allows you to start reorganizing your systems and to train your employees internally to say that, look, now to be part of that compliance, we will have to go through this. And I think that's where the internal awareness also, it's a byproduct. So I think, so those are the two important things that I would say.
Okay, cool. Thank you so much, guys, for your views. And before we wrap up the session, I'd like to maybe just do a short rapid fire round. We shuffle the questions around a bit. So if you don't mind, I'm just going to go around the room asking you guys for natural reactions to some of these questions. Okay, let me start with Mitesh. The first question is this. What's the one thing that you think all healthcare companies should do for their employees? Healthcare organizations for their employees. The one thing that every leader should be doing today.
Oh, okay. Maybe a 10 minutes morning one-to-one discussion.
Okay, Mitali?
Completely agree. I think I was literally about to say the same. I think one-on-ones are so invaluable, and many times we as leaders, keep ignoring problems until things break and they become really big. And so, like a preventive approach to that, and just having a one-on-one is super helpful.
Okay, Kanika?
Being empathetic, showing empathy in everything you do.
Okay, got it. And I'll start with you now, Kanika. What is the one thing that healthcare organizations need to stop telling patients?
Need to stop telling patients.
Yeah.
Wow. Need to stop telling patients. I think that's actually an interesting one.
Whoever
I
has
think we need.
whoever wants to go first, if you want a couple of.
Yeah. I need to think. Yeah.
So maybe Mitesh, I'll take a stride a little.
Sure. Sorry, Mitesh. What did you say?
I'll take up.
Yeah, sure. Please. What is the one thing that you think healthcare companies should stop telling patients?
We are the best.
Okay. That's a good one.
Well, because, you'll go anywhere and they just can't stop praising themselves. How are we different is what they want to convey, but then they end up saying why we are the best.
Okay, Mitali, any view on that?
Yeah, no, I mean, can't think of anything because we generally try and avoid being very preachy or very like, this is wrong, this is right, because it's, things are just super subjective. And I agree with Mitesh. I mean, we inherently, like, even with our salespeople, sometimes there's a temptation to say, oh, if you've consulted so and so, that's wrong, they are bad, and we are better. And we just
Right.
distinctly tell them that
Yeah.
do not criticize any other healthcare provider. You know.
Got it. And Kanika, you
I think false promises.
right.
I've seen that happening to me. So, yeah, I think false promises.
Okay. And since this is, there's a technology company at the back of this webinar, I'm going to ask you, what do you think is really going to shake fundamentally healthcare over the next 10 years? And I don't think we can say AI because that's happening now. Is there something else that you guys see which is actually going to shake healthcare over the next 10 years?
Yeah. Well, if I,
Yeah,
Mitesh
sure.
this
Go ahead,
side,
Nitish. Yeah, yeah.
it's gonna be the predictive analysis or predictive, not preventive, predictive analysis around the health of the patient or the
Okay.
anybody or a normal human being. That's gonna shake up very, very largely, and absolutely touchless diagnostic system.
Okay.
Today, you have to go out to a phlebotomist to get yourself pricked to collect the blood,
Right.
or you get into the machine to get yourself scanned. So there are many touchless predictive systems are coming up. They are still under the moderation and all, and multiple UATs or their kind of a pilots are going around the world. If it turns out to be the successful, then that's gonna be disruptive.
Okay.
And
Great.
then there are many pods also coming up for the in the area of IVF. That's IVF pods, which is currently happening in Israel, and wherein basis you can really select out the eyes, colors, hairs, everything of a baby that you are looking for.
Okay. Let's park that aside and let's move ahead with that's a slightly scary idea, but let's go ahead.
Yeah, it is. It is.
Midali, Kanika.
I think it's hard to honestly. I don't have very strong views on this, but who knows, right? We might get hit by super bugs that we are not prepared for, just like we were not prepared for COVID or global warming, which could unleash. I mean, just in the last 2 days, we've been reading about this brain destroying bug, which has caused a lot of deaths in Kerala. So a
Right.
lot of these, and getting that is getting exacerbated by the climate change, right? Because it's getting warmer and it's creating more bugs and parasites and so on. So who knows? I mean, what the next decade, we might just
Okay.
get hit by things we're not prepared for.
Okay.
Yeah, I think for me, it's the seeing health as a very connected aspect, like a complete health stack.
Okay.
Usually, I mean, until now, we've approached it, and even a patient has approached it as a gut problem or maybe a heart problem, a brain problem, and so forth and so on. I think healthcare is going to get very connected with
Got it.
everything. So it's going to be seen as one full stack. Yeah.
Got it. That would actually be awesome if that actually ends up happening. Cool. Great talking to you guys, Kanika, Mitali, and Mitesh. Thank you so much for taking the hour out. It was wonderful talking to you, and I think we've got some great points of view out as well. Um, Thank you so much. I think if there's some questions to be taken, Ashna or Anjali, if you guys are on the call, anything that we have from the audience, or can we wrap the discussion up?
We have a couple of questions, Sridhar. Maybe we have 5 minutes. Maybe we can quickly take it up.
Sure. Okay. Where do I see them? Can you maybe call them?
Yes, I will.
Okay.
So the first question that we've received is how to ease AI related concerns / worries across senior staff.
I see. So in terms of their own employee retention is what I assume the question is around. Okay. I think, Kanika, you want to take a shot at this?
Yeah, I think upskilling, very important.
Mm.
There has to be proactive upskilling frameworks. Make it a mandate
Mhm.
that one day in the week and incentivize that upskilling. Again,
Mhm.
speaking from experience, that's what we are doing, and we are also telling our clients to do. So my short answer would be incentivize upskilling and encourage it a lot.
Got it. Ashna, anything else?
Yes, one more question. How to find the right target customer?
Okay, that's interesting. Mitali, you want to take a stab at that? Customer education.
Yeah, I think
I
I
don't
mean
think Mitesh has this problem, so we won't go to him with this one.
right. I think if you understand who you're solving for, what you're solving for, and then, of course, conventional marketing, and you're essentially a lighthouse that is putting this content out there, you will start attracting those consumers and it just becomes easier. And I think a lot of the startups, which, some of the startups in chronic disease space, unfortunately, what has happened is in this uh, endeavor to quickly scale up, people have burned massive amounts of money in marketing and performance marketing and so on. But I think in healthcare, you can't put it on steroids. It does take time to gain trust, referrals, renewals, organic word of mouth, and the trust sort of starts compounding and building over time.
Got it.
But at the same time, you need to be a thought leader, put content out there, and you start acquiring and attracting the right consumer.
Yeah, on the same lines, I have a question for both of you, Kanika and Mitali, is for founders out there who maybe want to get into the healthcare space, right? Are there any sort of starting compliances and starting certifications that are absolutely essential that they need to know about? Or is it like, as simple as starting a tech startup is probably today, which is not related to health? Is there something extra to be done on the health side?
There are.
Okay.
Yeah, maybe Mitesh can
Sorry,
take
Mitesh,
that.
yeah, please go ahead.
Yeah, so having worked in multiple healthcare sectors and all, yeah, there are many compliances or the licenses. If you are into the IVF space, there is a 27 sort of a licenses and compliances before you even let your patient to enter your space to get, consulted. And
Got it.
likewise, it varies with the healthcare, the kind of stream that you are getting into the within the healthcare. Even
Got
with the
it.
diagnostic, also there are many licenses that one has to take up. Uh, as small as shop and establishment or the lease registration, ends up with the ART in the IVF sex space or maybe the ARB in the diagnostic or radiology space.
Got it. Got it. Got it. Okay, cool. Anything else, Ashna, or that's the limit of questions we have? You're on mute, sorry.
Sorry, we can wrap it up now.
Okay, cool. So thank you so much, Mitali, Mitesh, and Kanika for taking time out again. It was wonderful chatting to you guys, and look forward to connecting with you soon outside of this ecosystem as well. Thank you so much.
Thank you so much.
Thank
Thank
you.
you.
Thanks
Thank you, all the
everyone.
experts. Thank you so
Thanks.
much.
Thank you.
Bye. Bye.